Our next session is an introduction to the stroke care pathway, what it is and what it may mean for your group. Now, I'm super excited about this session. I'm going to learn loads. I know I am. We have such a range of perspectives and experiences involved as well. You'll start off by hearing from Jen Gardner, our Associate Director up in the Northwest. And then Sharon Walton, a clinical network programme manager from the NHS in Lancashire, will join and share her reflections around peer support. And then the wonderful Les Redfern, you'll hear from him, who is a carer representative, and a group member and group volunteer. So there's lots of information in this session. Do take your time digesting it, and what I would recommend is to check out the exhibition area, because there's a space there that has lots of information from the talks, and it will have in there some of the documents that Jen will refer to, so you'll be able to digest that in your own time. Okie dokie, so I'm going to welcome Jen to the event. Over to you, Jen, to kick us off. Thank you so much.
Thanks, Beth. Well, good afternoon, everybody, and thank you for inviting us to speak this afternoon. I work for the Stroke Association, but before I get started, I thought I'd just give you a little bit of information about me and my background and my connection to stroke. So way back, it seems longer than I like to remember now, in 2005, I qualified as a registered nurse, and I worked in the neurosciences units in Nottingham. So that's supporting people with a variety of different neurological conditions, including stroke. And I think that's probably where my interest and my passion for stroke really first developed. Fast forward a few years, and I moved into the third sector, and 10 years ago, I started working with the Stroke Association as what was then an information, advice and support coordinator. So that was going out to people after they'd had their stroke and supporting them in their post-stroke recovery. A few years later, and a few job title changes later, and I'm now working as the Associate Director in the Northwest, which sounds really grand, but it basically means that I lead the work that we do in the Northwest for the Stroke Association. So trying to make sure that we've got that we're reaching everybody with the support that we provide, trying to make sure that that support's of a really good quality, but also working with other organisations, including the NHS, to make sure that we're continually improving the whole stroke care pathway. And it's through this current role that I met Sharon and Les, who, as Beth said, are going to join us later on. And between us, we're hoping to give you a flavour of exactly what the stroke care pathway is and what it means for stroke clubs and groups, both now and in the future. So if we start with the first one, what is the stroke care pathway? In short, it's the care and treatment that people affected by stroke receive from the very beginning point where the symptoms of a stroke happen, all the way through to their long-term care and support. And in this next slide, I'm just going to break that down a little bit to tell you what the key elements of that stroke and pathway is, because there's a few steps in it. So first of all, there's the pre-hospital stroke care. So this is from the point at which somebody dials 999 through the ambulance response, and it's all the way up until that person gets to A&E and is starting to be treated there. The next stage is what we call the hyperacute stroke care. So this is concerned with that first 72 hours after your stroke. It includes all the scans and the tests that somebody would receive and all the treatment that they'll have, which will vary from person to person depending on the type of stroke and the treatment available for them. Following that, some people might be discharged home, but most people will carry on what we call their acute stroke care and treatment. So that's where you continue to be monitored and receive care and support and move into the next stage, which is rehabilitation. That acute stroke care and the hyperacute stroke care should both be delivered in hospitals with specialist staff who are trained in specialist stroke care and treatment. As I say, whether you went home or whether you went through the hospital or whatever stage, you should then receive, if you need it, rehabilitation. And rehabilitation is the support that's provided by our therapists, our physiotherapists, our occupational therapists, our speech and language therapists, and that's the support that helps someone to recover after they've had the stroke. Finally, the last part of the pathway is the life after stroke support. And this is the ongoing support provided to people to rebuild their lives after stroke. And whilst on this picture it comes at the end of the pathway, it really starts from the point at which somebody had that stroke, from that acute phase, and it runs alongside all of the other care and treatment. But unlike those individual stages, this continues for as long as somebody needs it. And it's this life after stroke support that's really important. And it's where our stroke clubs and groups sit in that what we call life after stroke support. As you can probably see from this diagram, there are a lot of people involved in stroke care and treatment. It's really complicated. There's different organisations, different professionals, and there's different pathways that you might go on depending on how on the stroke that you had. And to make it more complicated, it's constantly evolving as we get new research and evidence. We constantly change how we deliver the stroke care and treatment when we find out new and better ways of supporting people. So it's really difficult for managers and for clinicians to know exactly what they should be providing and how. So to help with that, we've got guidelines and policies that the NHS puts together to support the clinicians and the people working to understand what best looks like and how it should be achieved. And I'm going to talk quite a lot about one of these guidelines today. Now, I just want to mention at this point, whilst the fundamentals of stroke care and treatment will be the same wherever you are, the guidelines and the policies that are developed are individual to the different countries. So in England, we have NHS England, and I'm going to be talking about their guidance that they've produced. But in the devolved nations, there's similar guidance that's either being produced or is already there. And if you want to know more about that, we'll speak to you at the end about who you can speak to about it. But it's just to say that this is an England-specific guidance that I'm going to take us through, but it'll be similar in other areas. So let me introduce you to the National Stroke Service Model, sometimes shortened to NSSM, which I will not be doing today because that gets me very confused. But the National Stroke Service Model outlines best practice for care. It outlines what the optimal pathway should be. And when I was thinking about today, and I was thinking, how do I explain about what this booklet is and make it more understandable? Because we talk about this model, but what exactly is it? Well, that took me back to my childhood. Full disclosure here, I am a massive Lego fan. I was as a child, I still am now. I absolutely love it. And to anybody else who has also enjoyed playing with Lego, hopefully this is a really familiar diagram to you. But for those of you who were maybe outdoors for your childhood or had better things to do, just to explain that when you get a box of Lego, you get lots and lots of different bits. And then you get an instruction manual a little bit like this. And it tells you step by step how to put all of those bits together and how you eventually come to the end product. And it occurred to me that really that's what this National Stroke Service Model document is really all about. It's a step-by-step guide to giving the best care and treatment. So what does it look like, this instruction manual for stroke? If we go on to the next slide, here are some of the pages that are in it. Now, I don't expect you to be able to read these. That is tiny, tiny writing. And as Beth said, this document that I'm talking about now is going to be available in the exhibition area if you did want to look at it. But I just wanted to give you a bit of an inside look at it. And as you can see there, there's flow charts of patients' care and treatment. There's diagrams which make it clear what you should receive when. Each of those parts of the pathway that I talked about earlier has its own chapter. So in that chapter, it talks about what good care should look like, what we're hoping to achieve by it, what the end result should be. But also it breaks down into who should be involved in that care and treatment, how they should provide it. And this is all based on evidence that we've gathered from healthcare professionals, experts, researchers, and stroke survivors and carers who are obviously experts by experience. Now, I'm not going to go into all of this document. It's a very long one. But I wanted to focus on a key element that really relates to today's topic, and that's the section 7, which talks about life after stroke, because it's in this section that stroke clubs and groups are mentioned. So what does it say? Well, it says that life after stroke services, it tells us what they provide. They're an ongoing care and support for people that helps them to rebuild their lives and minimises the risk of future cardiovascular events. So that to you and me means hearts and strokes and heart attacks even. So how we can reduce, it's a question we get asked so much, how will I have another stroke? How can I reduce my risk? And so life after stroke includes some support around that. And what should they be? Well, it says that these services should be accessible to all people affected by stroke. Now, as with everything in the stroke pathway, and as I mentioned earlier, this document talks about what an ideal stroke pathway should be. And we know not everybody gets this at the minute, and we know that we're not there at the minute with making sure that all of these services are accessible to everybody. But the aim and the ambition is that everybody should be able to access it. And as I've said a little bit further on, that it should be from the acute phase and onwards. And it recognises something that is really, really important. It recognises in the description of this part of the pathway that people's needs and their circumstances and what's important to them can change significantly over time. So they may need to continue to access services long after their stroke. And it's really unique to this part of the pathway that it's clear that this should be a long-term support for people and something they can come back into if they need it. So what are the core components of this life after stroke support that it talks about? Well, on the page coming up now are the 9 components that it talks about in the model. So a lot of them are fairly self-explanatory, but just to explain, that first one there, personalised care and support planning. So that means that there should be someone, a key worker, who sits down and works with stroke survivors and their families and carers to talk about what's really important to that person, what their needs and what their hopes are for their recovery, and puts together with them a plan of action of what we're going to do together to move forward in that recovery. And the next step, which is important as part of that recovery, is around information provision. Now, I've included it in this slide. It's included in the model. Information we hear all the time is people either don't get the information they need, they get too much information at the wrong time. So the model talks about it being the right information at the right time in the right format. So it goes into more detail about what we mean by that. And throughout somebody's care and treatment, they should constantly be reviewed, because your recovery will happen. We hope people will move forward, but certainly circumstances will change. So there should be a continual reviewing of people's needs, and that's what we call the post-stroke reviews. And there's a couple of steps that we think, there's a couple of timings that we think are really important to do these reviews, including at 6 and 12 months. But it is really just a continual part of the process. There's a few jigsaw pieces on the picture. By the way, the actual model isn't a jigsaw. I just did that because I was playing around with PowerPoint, to be honest. But it's not a jigsaw in the actual model. But the bits around communication support, return to work, and emotional support, they should all be available if they're needed. So if somebody's communication has been affected by their stroke, they should receive long-term support for that. Again, for working age stroke survivors, that's about helping them to get back to work. Emotional support, we know, is needed by most people following a stroke, and that's a really important part of this work, as is carer support. So on the previous screen, I think it said around that it should be accessible to people affected by stroke. And what we know is that the stroke doesn't just affect the stroke survivor. It affects their friends, their family, some of their family who may become their carers. And so they all need support themselves to come to terms, to have their question answered, and to provide support and ongoing support. So that's a really core element. And the only blue one I haven't done is secondary prevention, because I've touched on that a couple of times. Now, I'm really sorry, because I was going to do the grand reveal of the middle square, but I've got my timing wrong. You weren't supposed to see the middle square until now, when I said there's a piece missing in this jigsaw, and that piece is peer support. And I really wanted to stress how brilliant it is that in a document that gives guidance about all parts of the care pathway, they've recognised, so researchers, healthcare professionals, policy writers have recognised that a really important part of someone's life after stroke support is peer support. So what does it say about what exactly peer support is? Well, don't tell anybody, but there's extra guidance that goes on top of the guidance that we've got. So the National Stroke Service model, the document that I've spoken to you about, has a few extra documents, a bit like your Lego used to come with, a bit for the car, a bit for the garage, a bit for the house, and then how you put it all together. With the Stroke Service model, there's a little bit that goes into more detail about life after stroke. And that hasn't actually been published yet. That's being written as we speak. But what we do know, or what we're pretty certain will be included in there, is that peer support can take a whole variety of forms. So it could be led by volunteers, it could be remote, or it could be face-to-face. It could be one-to-one, or it could be in groups. We know that there's a lot of peer support provided in stroke support groups, and we know that there's times where it could include or could be led by carers and stroke survivors who are experts by experience. And we also know that in the voluntary sector, there's a lot of experience on providing peer support. And we think all of these on this screen here are going to be included in what peer support could be in the guidance. So let's have a quick recap. I hope you're all still with me, and I hope with your lunch that you had a good coffee, because I know this is a lot of information to take in. But we've got the bricks. We know what should be in good stroke care pathway. That was the first screen. It should include ambulances, it should include long-term support, it should include rehabilitation. We've got the instruction manual that tells us, that's the National Stroke Service model, that tells us how it should all be put together. But what we need now is we need someone to build that. We need someone to put all the different parts together and hopefully give us that model of excellent stroke care and treatment. But how do we get to that bit? Well, for the last bit of this talk, I promise this is the last document I'm going to mention, but I'm going to go back 3 years to 2019 when NHS in England again produced their long-term plan, what they thought should happen in the next 10 years. So as I say, they wrote this in 2019, and within it, they set out what the key ambitions and priorities should be for the NHS in the next 10 years, which treatments, which conditions should be prioritised. And what is really positive is stroke was recognised as a priority, and they put together some key ambitions for what they think should be achieved in the next 10 years for stroke care and treatment. And they also included in there the mechanism, or should I say the way in which they thought that we could achieve these really ambitious targets that they've set. And that's through something called integrated stroke delivery networks, which they say are a key vehicle for transforming NHS care, stroke care, sorry. Now, I don't know if you're like me, but by this time, I think if I was listening to this talk, I've heard so many different so much different terminology. It starts to blow your mind. The NHS does love it. But I thought I would break down for you exactly what is an integrated stroke delivery network. So fundamentally, and if you double click on this one, hopefully, fundamentally, a picture should come up. It's people. It's lots and lots of different people working together. Now, I'll be honest, I couldn't get a picture of NHS professionals in Lego people. So just to be clear, this isn't an actual picture of the people involved. We definitely don't have any astronauts working in the NHS. As far as I know, we may do. But you get the idea. It's just lots of people. But the difference is, because we've always had people, the difference is there's some people who are specifically going to be part of these networks to really bring everything together and to make that transformation in stroke care and treatment. So I thought it might be useful if I just give you a little bit further about that term integrated stroke delivery network and what the different elements of it mean. So if we go on to the next slide here. So firstly, integrated. So that's all about bringing people and organisations together across the whole pathway. And it may seem fairly common sense that you do that, but it might surprise you to know that historically, ambulance trusts have worked on their own, different hospitals have worked on their own, different providers have worked differently, even therapists who work in the hospital haven't worked with therapists in the community. So this is the NHS saying, if we're going to get this right, we need to bring all those people together. So that's what they mean by integrated. Stroke, well, I don't think I need to explain that word, but delivery is the next word. When I was thinking about this, I don't know about you, but since COVID, I've got a lot more delivered from online shops. So when I was thinking about the word delivery, well, it takes something and it transports it to something else. And that's what they're hoping with these ISDN, that they're going to take those bricks and that instruction manual, and they're going to design and deliver and produce this model of really excellent stroke care and treatment. So that's the delivery element in it. And finally, networks. Well, it's great having lots of people brought together, and it's great having a plan, but as we know, it can be really difficult. So we need to take a collaborative approach and put in place ways of communicating and people to take the lead and take us forward. And they need to include everybody from from that pre-hospital stage right the way through. And so the next slide is going to show you in practice what that means. So this is a real life structure of an ISDN in the Northwest. Now, For those eagle-eyed amongst you, you may have noticed that this, at the top of the page, it's Lancashire South Cumbria, and it's got an extra N in Integrated Stroke Delivery Network. And that's because in Lancashire South Cumbria, they're also including neurorehabilitation in this network, because it's a lot of similar people and similar staff. So that's just to explain that N there. But this is a really, really complicated picture. And I just want to just tell you through some key points. So this is the actual mechanisms of how we're moving to that stroke care. So at the bottom, those light blue tiles, finance, workforce and digital, if you can read them, but I wouldn't expect you to be able to, the writing's tiny. Those are groups of people who work together across, they're what we call cross-cutting directorates. So they work across the whole pathway, but they take that umbrella view of all the finance and all the workforce, whereas in the past we've just looked at it individually for our little bit of finance and our workforce. So those at the bottom are across the whole pathway now. And then if we move up a step, we've got our dark blue tiles. Now these are working groups. So this is when the local area says we really need to focus on this particular element. So you can see the word psychology there. In Lancashire, they felt that they really needed to improve the psychological care and support that people receive after stroke. So they brought people together just to focus on that bit, people from across the pathway. And we'll hear a bit about that through Les and Sharon. But these dark blue tiles, they'll come and go, and they'll be unique to each ISDN in each of the different areas. And they work on particular pieces of work, which they then feed into that level above. So there's 5 slightly darker blue tiles there. And that's where we bring together each of the groups from the different parts of the pathway. So all the people concerned with urgent and emergency care, all the ambulances, the A&E staff, and the providers of those services, they all come together regularly to discuss. And I think I'm repeating myself, but it's important to say that this is across bigger areas than we've ever done it before. So the whole of Lancashire, South Cumbria. I possibly should have mentioned that there's 20 of these ISDNs across England. So that gives you an idea of the footprint of them. But yeah, so they'll work together. And then they feed this into a patient and carer assurance group. And this is a really fundamental part of an ISDN. And again, we're going to hear about that through Sharon and through Les. But this is saying that all stroke care should involve stroke survivors and carers. They're the experts by experience, and they're the people who should be telling us what's important to focus on. So all these people feed into that group and hear from that group. And then as a collective, we come up to that ISDN board there. And that's where the decisions are made from all the information below. So that is a whistle-stop tour. There is a huge amount that you have heard there. But hopefully that makes it clear that we know what should be delivered. We've got an ideal model. And then we've got the mechanism. This is the group of people who are going to bring it together. And we're really lucky today because we have someone from an ISDN. So I'm going to hand over now to Sharon, who's going to tell us a little bit about what her role is within this integrated stroke delivery network and some of the work that they've been doing up in Lancashire.
Thanks, Jen. Good afternoon, everybody. My name is Sharon Walkden, and I'm a programme manager within the Lancashire and South Cumbria Integrated Stroke and Neurorehabilitation Delivery Network. And as Jen has covered with her presentation, the long-term plan stated that stroke's a priority, and there needs to be these delivery networks across England to design and deliver the effective stroke services, make sure there's high quality specialist care available, and improve patient experience and outcomes and safety. And we are unusual to have the extra N in our delivery network to include the neurorehabilitation element. And that's mainly because it's recognised that stroke rehabilitation and neuro rehabilitation, there is a lot of similarity and crossover. It's very similar groups of staff that are involved, your therapists, and so it makes more sense to do it in an integrated way rather than very separate services. So this image that you can see here, this sets out what the integrated stroke and neuro rehabilitation delivery network covers. Similar to the diagram that Jen showed with the ambulance and the urgent care and the hospital and the rehabilitation, those are all under the remit of being delivered through the delivery networks. And accompanying this, we have an end-to-end service specification. So it's a large document with a lot of detail in, and it sets out what should be delivered at each of these stages that you can see here on the chevrons that are going across the centre. So what could you expect as part of the prevention work? What could you expect as when a stroke occurs and you call 999 and it's that really urgent medical treatment stage, when you're on an acute stroke ward, when you're receiving rehabilitation, be that as an inpatient or in the community, back at home, and then life after stroke and that long-term support, both the social and the emotional side of things. So in addition to setting out what should happen at these stages, each section also includes contribution from patients and carers to really set out what they'd expect at each stage as well from a patient and carer perspective. And it's certainly included in that the importance of peer support, because whilst no two strokes are the same, and whilst people have very different circumstances and situations, it's really felt the value of being able to talk to others who've had similar experiences, be that the stroke survivor or the person who cares for the stroke survivor or their family. So just move to the next slide, please. So in addition to the stroke service specification and the contribution from patient and carers, they are involved in everything we do, and hopefully they find it in a meaningful way as well, because we really need to drive work forward based on their experiences and expectations and trying to improve that experience of patients and their families. So we have a monthly board meeting. The board they meet to work towards the aim of having A-rated stroke services across Lancashire and South Cumbria, and to progress other work streams as well that's going to improve patient and carer experience. And this meeting is always opened. The first item is always the chair or the deputy chair of the patient and carer assurance group, providing that patient carer perspective to really emphasise the aims of the programme while we're all in attendance. What we're working for every day is to improve the experiences of the people who need the services. The patient and carer assurance group were also involved in creating a business case that proposes the development of acute and comprehensive stroke centres in the region. And these centres are going to be places that people can receive 24/7 treatment up to the first 72 hours following a stroke, to make sure they get that intensity right at the beginning, and hopefully that'll improve to improved outcomes, reduced disability, and reduced number of deaths as well due to stroke. The Life After Stroke work stream is just as important as all the other elements of, sorry, do you want to just go back to it? Thank you. The Life After Stroke work stream is just as important as all those about, the urgent, acute and rehabilitation. And this is most often the case where people tell us they just feel like they've fallen off a cliff, that, they had all this intervention, perhaps people coming around to the home, got different therapists, all the other things that are perhaps involved with the first 6 months following a stroke, and then all of a sudden it just feels like there might be nothing, that they just left. So again, based on patient and carer feedback, we have got a dedicated group that are looking at psychological support following stroke. Peer support features strongly in that, because whilst psychological input will be provided by qualified psychology teams for, complex and more higher level interventions, there is absolutely no doubt in the importance of peer support and talking to someone who's been through it before, to help with those lower level interventions, and they're a real help towards people as well. And it's for the carers as well. So we've got support for carers there, not just the psychological support, but we're developing a carers work stream, because their lives change too as a result of stroke in many, many different ways. And if they've got caring responsibilities, it's even more important that they're looked after both physically and emotionally to help them to do that caring role and have a quality of life as well. So I have mentioned our patient care assurance group a few times. There's a screenshot there. It's made up of stroke survivors and people who care for people who've had a stroke, and also members of the Stroke Association as well. And they do an amazing job. Just a fantastic group of people in providing feedback, shaping the work, and really helping make those improvements to the stroke services in the region. So I will hand over to Les, I believe now, who is one of our patient and carer assurance group members.
I know I don't look like Les, and I'm not Les, but I just wanted to come back on to thanks for that, Sharon. That was really great to hear from somebody who is managing the ISDN about the type of work that you're doing, and also the role that the patient carer group play. So I just wanted to introduce this next bit. We are going to hear from Les, but if we 2 clicks will hopefully put us some circles around the key parts that Sharon's just talked about. So Sharon mentioned there about the life after stroke element. We keep talking about it, but it's the part of the pathway that includes all of the things that happen after somebody's come home from hospital, including clubs and groups. And the patient assurance group Sharon mentioned, and I've mentioned, that's what Les is part of. But Les is part of a lot of things. Les is a fantastic chap. He is not only a carer for his wife who had a stroke, but he's also a member of a stroke group in Lancashire. And as well as volunteering for lots of other charities, he also sits on our patient care assurance group for the area. So we're going to hear from Les now about his experience with that, I hope.
Good afternoon, ladies and gentlemen. My name is Les Redfern. I'm a Stroke Association volunteer covering East Lancashire, and I'm also a full-time carer for my wife, Linda, who had a major life-threatening stroke. I think now, it's almost 8 years ago now, and that resulted in her having to have a craniotomy. This obviously has left her wheelchair dependent. She's no peripheral vision on her left side, and she suffers from chronic neuropathic pain. However, life after stroke for us, we make the most of it. I take her out every day. We concentrate on the positive, we concentrate on the can-dos and not worry about the can't-dos, although that is very hard. We just get on with it. I also run a couple of peer support groups for the Stroke Association, an allotment group, a football group. I do some befriending. I volunteer in the local charity shop for Carers Link Lancashire, and I'm a patient and carer rep on several different work streams. I enjoy all my volunteering roles, but my passion is working with the patient and carer assurance group. because I'm working alongside other like-minded individuals with lived experience of stroke. And the reason I decided to join this group was I thought things were getting a little bit stale with my current roles. And I was about 6 years post-stroke from my wife a couple of years ago. And I felt I wanted a new challenge. I felt I wanted, if possible, to maybe help affect the future for stroke patients, carers and their families, to get, maybe have better clinical outcomes. And I saw the Patient and Carer Assurance Group as a perfect platform to do this because it involved focusing on the stroke care pathway. And that's something I'm very passionate about. And although, like I said, I was enjoying my current roles, and I still am, everything about my current roles were the present. I was affecting the present for people, and I get some fantastic feedback from that through my peer support groups. And it is rewarding. But the opportunity to join this group, I thought, was an opportunity too good to miss. And has the group met my expectations? Well, no, it hasn't. It's exceeded them. And when I joined the group, the first thing that I noticed straight away was the fact that it was clearly evident. It was clearly evident along the pathway that there was a clear, holistic approach to the decision making, and to have the opportunity to be involved in those decisions was extremely rewarding. And I always remember when I first joined the group, one of the things I did after 2 days, I was that excited about being part of this group. And I wanted to share that with my groups, my thoughts about the group, and explain really what the group was about, what our ambitions were as a group, what were our priorities, our aspirations. And so I put together a presentation, and it was really well received. It was just like 10 slides, and it helped me summarise what the Patient and Carer Assurance Group was all about. And I know on one of the slides that really hit it home for me was I put together was about the ISDN having an expectation that our voices of lived experience will be integrated into proposals and decision-making processes that's developed under the ISNDN umbrella, and to ensure this was truly patient and carer focused. And that is 100% true. That is, and that does happen. Another thing that I also got involved with, I really, really enjoyed, is when we were making the decision on the 3rd acute stroke unit, stroke centre. We did like a scoring exercise, and this was particularly rewarding. And again, to summarise it to my groups, I actually put forward a slogan. Slogans were very popular at the time. It was just in the COVID pandemic, as Boris there always had his slogan under his lectern, and I put a slogan together that read, the objective of the acute stroke centres were to save lives, to prevent disability, and enhance the services. So when I was talking to my group, I just simply said, the objective of this group, this exercise, should I say, the new acute stroke centres is to save lives and prevent disability. But how do we do that? We do that by enhancing the services. And I got told that would be used in future platforms, future communication platforms. And it did. It made me very proud. And to see the progress the group has made over the last 2 years and know you're contributing to its successes, it is really, really rewarding. And I really enjoy being part of that group. I think it is my main passion at the moment, because we can see the effect that the group's having already with the work that we've done. And I'm not saying I don't enjoy my other roles. I do. I enjoy all my roles within the Stroke Association. But I don't want really people to have to go through what myself and my wife went through, and we're still going through. And if I can affect that in any way, or contribute to that in any way, then, you know, all the better. Thank you.
Thanks, Les. So articulately put, and such a good summary of what you do. So you'd be glad to know you're just about at the end of me speaking. I'm not going to give you lots more information to try and digest. I think you've all had plenty there through this presentation. But again, just to summarise really, that the NHS places value on peer support, and that's a really positive step. So much so that it's mentioned in key policy documents as an essential part of excellent stroke care and treatment. And that peer support is the type of thing that's delivered often through our stroke groups and clubs. We know that we're not there everywhere. We know that there's a lot of work to do, but with the introduction of the integrated stroke delivery networks that Sharon is part of, and Les through the patient carer, we hope that we're going to see more improvements in stroke care and treatment, and a real ambition to make sure that all elements of the pathway are delivered in all areas of the country. And so hopefully in the future, anyone affected by stroke will have access to peer support in its various forms, including through our stroke groups and clubs. And that takes me on to the final slide, which is there any questions? I think Beth's going to come back now and talk us through the next stage, but Les, Sharon and I would be happy to answer any questions that anybody has about what we've spoken about today.
Thank you so much, Jen, Sharon and Les. I don't know about everybody else, but I was glued to the screen, absorbing it all. I found it an absolutely fantastic presentation. And I am definitely doing bedtime reading tonight with that document, the National Stroke Service Model. I'm looking forward to delving into that myself a bit more. So thank you so much. And do check out the information from our talks part in the exhibition, because that has the documents in there that you can digest, but also it has information about all of our locality teams, so our engagement teams across the UK. So you can find out who your link is, your engagement team, contact them by dropping them an email. And if you're interested to find out what's going on in your specific area around this work, especially around the integrated stroke delivery networks and patient involvement, and how maybe you'd like to get involved, the engagement teams are your point of contact. So all the details there are in the exhibition space. If you're not sure where your group is in the UK, you're not sure what area it sits under, whether it's the east of England or the southwest or the southeast, just drop us a note on the contact us button and we can find that out for you so that you can link into the right team. Fantastic. Okay, well, keep posting your reflections and comments, because we're going to come to the question and answer session with our panel in a few minutes. But before that, I would love to welcome Anne back to give us a little bit of a flavour of what's been happening on the chat box for those that may be not using it at the moment but would like to hear what people are saying.
Yes, thank you, Beth, and to all our speakers. Lots of positivity in the comments, especially praise for Les. And in the earlier part of the talk, people were reflecting on their own experiences of stroke. Some of them were many years ago, and they had hope that things were improving and that they have heard this themselves for their own groups, that rehabilitation has improved for the better over the years, but there is still lots of work to be done. Joni and Clive have also commented that they're glad to see that the peer support is at the heart of this work and that it includes the experiences of carers, family and friends too. Laurie has commented that she has been lucky enough to be involved in some of this work of improving stroke services in her area of Bristol, North Somerset and South Gloucester, and working on delivering the long-term NHS plan. And she says it's great to see how things are improving, but there is always a bit of a disappointment when she sees local groups are sadly having to close for various reasons. And Phil, who is a patient participation group chairman at his local surgery, also acknowledges this work, and he's recently been made aware of it. And he just acknowledges that it is all very positive, but he is concerned that there might be some resources and staffing issues in some areas which might affect the overall services. And just a few comments really, just touching on that, is about the funding issues and how services can vary quite a lot in all different areas. Please do keep posting your questions and we'll get as many of those asked to our speakers as we go.
Thank you, Anne. Wow, what a wealth of knowledge and expertise we have across the network in this space, hearing people that are similar with Les working in this space through your role, either as a group or as your experience in stroke. So yeah, I'm really buzzing with ideas on how we can carry on this conversation post the conference, so this learning continually is able to be shared across the network. Okay, well, if we can invite the panel back, we've got a good 12 minutes for some discussion and some questions, which is lovely. So do keep posting them, but we do have a few to get us started. So one of the questions has come from Mike, which is a really interesting question actually, is does the pathway have any legal clout? Now, I'm not sure, Sharon, Jen, Les, if you're aware of this, would anyone like to jump in and share a perspective?
I'd say that the pathways are definitely recommendations. It's definitely what we should be striving towards and what we should be implementing to make sure that stroke services are the best we can be. And, you know, why wouldn't you, almost? But I don't think it's a legal obligation that, you know, or compulsory if you must, but it's definitely advised and suggested that this is the route to follow in trying to improve stroke services and deliver high quality ones.
Thank you, Sharon.
Just to add to that, with policies in the NHS, they are there as this is what we're expecting should be delivered, but it is really complicated. I know Anne mentioned about funding being an issue and different areas have different funding streams, and it is really complicated. But just as reassurance, we heard from Juliet this morning, didn't we? And Juliet co-chairs something called the Stroke Delivery Board. And that's a group that sits above all the ISDNs. And it all the ISDNs have to feed into that board the progress they're making towards that excellent stroke care and treatment. And if there are difficulties, the ISDN, the Stroke Delivery Board, is there to try and support people, support the different areas to overcome any barriers that are in the way. So there is a mechanism in the NHS to know what's happening in the local areas and how they're progressing towards it. And as Sharon says, there's the ambition that this policy will be something that's adopted across.
Thank you, Jen. Thank you. There's a little bit of delay, but we absolutely got all that. So thank you so much. Another question that has come through is from Joni. Is the information that you've spoken about today, is it taught to medical students? So medical health professionals that are doing their training, how much of this goes into what they're learning?
That is a really great question. And I don't know the absolute answer to it, I have to say. What I can tell you is that certainly in the Northwest, we take part in some of the training that's delivered to medical students. So by we, I mean our volunteers, who are people who've experienced stroke, actually go to medical students, to their lectures, and talk about their experience. This particular document is so recent, it's probably the model itself hasn't been taught, but all medical students will receive the latest research and evidence base for the care and treatment that they're receiving. So they should understand what the best care and treatment is. But how much they get, I can go back, I'm not going to say how many years it was, but to my nursing, I know within my nursing training, we only got 2 lectures on stroke. I was lucky enough to have a placement on a stroke unit, so I learned a lot more about it. But I think it's a really interesting point, and I think it's something that maybe we should be trying to do more of, to make sure that it is fully covered in the syllabus, because they have so much to learn about, but we need to make sure that that yeah, it is. So I'm not 100% certain, but whatever is delivered, I'm sure we can probably do more.
Thanks, Jen. Thank you. The next question, and I think you touched a little bit on this, Sharon, when you were talking, because Ruth was wondering, when we're talking about peer support, are we considering in that the social, the emotional support? I suppose it's, what do you see as peer support in your locality and as part of this work?
I think definitely both, and it is unique to what people probably get from it and give to it. I don't know if Les can perhaps offer more, seeing as that's something that he provides on a regular basis.
Yeah, I mean, that's how peer support comes in many forms. Like I say, it comes through the groups, it comes through individual. You know, I'm talking to people all the time. You know, even in my role in Carers Link, you know, when they're coming in now, asking if there's anybody they can talk to that's been involved with stroke. You know, I've got involved from that side of things that haven't come through the Stroke Association. But I think it really does help people, you know, cope with life after stroke. You know, I've had some just amazing feedback from people I support, you know, and it just makes everything so worthwhile when they're saying, you know, my life's so much better as a result of having your involvement, Les. And, you know, it's priceless. That sort of feedback it's really priceless.
Absolutely, Les. And just touching on that a little bit in terms of what you see the core sort of components of peer support, whether that's looking at it from your experience in your group, how do you see your group making a difference through peer support? What is it to you that's fundamental in that?
I think one of the main things, well, since I've joined the group, but that's what I wanted to do. I wanted to be involved in future support, if you will. I wanted to be involved, you know, hoping to make a difference to people. And it gave me so much confidence joining the group. You know, I was a bit apprehensive at first, but now, you know, knowing that, you know, this life, you know, after stroke, it is, you know, or life support after stroke, it is for life. You know, it's not just support for them 6 weeks or so after, you know, somebody's been discharged from the hospitals. It's knowing that, you know, you can get back into the system. You know, I talk to a lot of the groups, and initially they used to say to me, "Oh, that's okay. Everything's looking rosy for the future, but what's in it for us now?" You know, because they felt like they had been abandoned. Over a period of time, you know, they know now that they can get back in, you know, refer back into the system. So it's giving them, you know, more confidence in the future as well.
Absolutely. Thank you, Les. So much in there, isn't there, in terms of what you're saying? And I think, yeah, the fact that there's this long-term support through groups is like a touch point, isn't it? It's a touch point for someone's life, as either they may be transitioning into different parts of their life, whether they might be going back to work or they might be retiring, but there's always a point in a group where they can come back to and connect. And I think you're absolutely right in terms of that touch point. It's really, really fundamental. I think there's someone's doggy that wants to make an appearance at the
it's my
no,
dog.
it's fantastic.
It's my dog. It wants to come in.
He wants to come in and be part of it. Absolutely, more the merrier, Les. Fantastic. We had another question actually, just in terms of the local hospital, and how do you know? How would one find out if one's local hospital is doing well in the pathway? So I know you mentioned that bit, Jen, before about sort of an overarching body that's looking at it all, but is there anything that's published or that's available in a locality that shows how?
Yeah, so we're actually quite lucky in stroke. We've got something, and as I say, the NHS loves its acronyms, don't they? And they love its long words. It's called SNAP, and that stands for the Sentinel Stroke National Audit. And basically, at all parts of your care and treatment, the professionals that are treating you input data into SNAP. And that then converts the data and enables us to see how people are doing in their different hospitals. So Sharon mentioned before that an ambition is to have all our hospitals rated at A on SNAP. And that's what that means. That means that they are hitting all of the targets that have been set and they are giving the best type of care. So the scale goes from A to E, and it covers the whole pathway from ambulance treatment through to discharge. And you can look at that. The results are published. If you Google SNAP, it's a double SSNAP. You'll be able to see the results from all the hospitals. There's a little bit of a time delay because all the data has to be put in and analysed. So it might be that you're looking at last year's results as opposed to the latest. But you'll be able to see it there. Or for most areas, if you were to go online, a lot of the ISDNs now have their own internet pages. So if you were to Google your local one, it might tell you what they're working on. If you looked in Lancashire, South Cumbria, they've got all the different bits of work that they're currently doing, and that sits on a website for the whole area, for the integrated care board of that area. So but yes, SNAP is probably your best way to see it. But yeah, a Google. The other thing you mentioned before, Beth, is to get in touch with your local engagement lead, because they might be able to give you where to go to for more information in your particular area.
Fantastic. Thank you, Jen. And I've just got a question around, what are you most excited about in this work? So maybe if I come to Les first, so your role in the patient assurance group, what are you most excited about that for right now? What's the thing that you're most happy and excited about in that work today?
Just really the future. I'm just excited about, the prospects for people's life after stroke in the future. I was, when my wife had a stroke, I was really angry. I was angry for a long time. It was, it was like, why has this happened to us? Why is my wife not recovering like some of the other people are recovering? And, obviously at that time I didn't really want to get involved with anything. And then all of a sudden, the peer support groups were offered to me while we was in hospital, and I wasn't interested, if I'm honest. But then, fair play to, it was Viv at the time, Viv Law. She used to come round and visit the wards, and then eventually she made a home visit and introduced. I said my wife's, passion was gardening. Introduced us to the allotment that I now run, and to see the difference on my wife's face, to actually get out there, and get involved. And she was limited what she could do, but, she really, really enjoyed it. And, I thought, I want that. That was like the light bulb moment for me, that I wanted to get involved. And, because I saw that difference that it's made. And that's carried on, and at the moment, I see a better a future due to the involvement and the group that we have. You know, it's great. It's fantastic. Sorry about the dog. The dog's putting me off. If I'm honest.
No, it's fine, Liz.
Yeah.
We're all at home. It's absolutely fine. This is the way it is with these meetings. It's absolutely fine. And I think, yeah, the point that you're making is actually you being involved in these in this assurance group. You're feeling it is really meaningful, and then you can see that actually your voice is taken into account, and you can see it making a difference. And I think that's a really huge takeaway, isn't it, from today, is that that obviously you're looking at it from quite a broad spectrum. I assume your involvement in that assurance group isn't specific to stroke support groups, but I'm sure you bring that knowledge of groups to your conversation and talk about how important they are and what you feel needs to change in order that people get support from groups, that it's equitable and people are able to access that support. So yeah, it's a huge takeaway that you feel positive about
to be involved in every stage of the pathway. That is very, very rewarding. I wasn't expecting that when I joined the group, you know, and you know, to know that you're involved in these decision makings, and you know, that is extremely rewarding.
Fantastic, thank you. What about you, Sharon? Is there something that you feel excited about today, right now, about this work?
Yeah, for me, it is getting the psychological input following stroke right, because there's so much focus, and rightly so, on the physical side of things, and making sure people get the time critical treatment and that they get the rehabilitation they need. So, you know, that should improve quality of life physically and what someone's able to do. But given that a stroke is something that no one plans for, it can turn your life upside down in a second, and those around you, it would just whip away all the immediate plans that you were thinking of and had. So I think being able to provide that right psychological input with the right team at the right time is going to be the next step on really making things better for stroke survivors and the family.
Thank you, Sharon. Sounds really, really vital and important. It's good to hear that that's happening. And Jen, any final words from you in terms of excitement on this work right now today?
Well, I'm excited. Les has bought the dog. She's good. I think the thing that excites me is that in the past, and a bit like Sharon was saying about the physical side, I think we often look to the acute care and treatment, and there's been a lot of focus on that and a lot of funding for that. And that is really, really important. And we're still campaigning that could be improved. But what's really nice about the National Stroke Service model is that it looks at the whole pathway. And what we hear time and time again is that acute bit, it's a very small part of it, but the rest of it is a lot of it. And it can take such a long time for people to recover, or a lifetime in some cases. And the fact that the model really holds equal importance to that long-term support as it does to that acute support is what I'm really excited about, because that's what we've heard time and time again. People say that it just isn't there. So that it's been recognised how important that is going forward.
Fantastic, thank you. Wonderful point to end on. And hello and welcome to Pixie, the dog. Fantastic. Brilliant. Well, thank you all so much, Jen, Sharon and Les, for an absolutely fantastic session. I've learned so much. So huge thank you for all your time in delivering that.